this HIV funding and the delivery and prevention will affect my community and my constituents. So I think it's fair that we ask these questions today. My question in regards to the HIV funding was, it was announced that we didn't want federal strings attached. Can you, Mr. Commissioner, tell us what those strings are that you didn't like?
I'm not going to be able to go into detail on that, Senator. I think the key issues, we're having discussions now with many of our stakeholders to discuss those very things. So we don't want to get out ahead of ourselves to start having those discussions publicly while we're having those discussions with stakeholders and a lot of our partners that work with us in this front. I think it's understood that a lot of times with federal funding that there can be inefficiencies built in, and so there's an opportunity for us to be more efficient, a little bit more modern in our way of distributing these funds and getting it to folks who really need it. So we're working on those discussions now. We're having a lot of those discussions with stakeholders and people that are partnering with us.
So speaking of the stakeholders, I had requested from your office last week a list of the organizations that received the $8.8 million. I have yet to receive that because what I would like to know is, will these organizations, same organizations, be receiving the continued $9 million that you will be appropriating directly to in this new administering of the funding?
I think we're having those discussions now. Deputy Commissioner, I don't know if we have those names.
Senator Oliver, we can process that request.
At what time?
We'll go back and we'll get a list together and we'll work through our liaisons to make sure you get that.
Approximate number of organizations and where those
that we directly
are
fund? That we directly fund, I'd say somewhere between 12 and 15, but that's a guesstimate on my part. That's my best recollection at this point.
Can you say geographically where those organizations will be located?
They're spread out across the state, primarily in metropolitan regions.
Of Nashville and Memphis?
Chattanooga, Memphis, Nashville, Knoxville,
Okay.
Johnson City, some of the larger counties in the state.
Thank you. One of the things that gives me concern is that the new appropriation will be targeted for other priority populations that were listed, namely first responders, pregnant women, and the like. Can you explain why the shift away from vulnerable populations, how that came about, what the reasoning is for that?
I'm not sure that if you're referring to a particular article, or I'm not sure that's either speculation from that. I know that I think we're not having those discussions. Because the governor said that. I'll let the Deputy Commissioner kind of address that then.
Yes, ma'am. We are, in addition to what we normally do, we will include those populations. So it's not necessarily a trading out,
Okay.
but more of an inclusivity, I would say, of those groups that you mentioned.
Okay. Is it correct that now the funding will flow through health departments, municipal health departments? And will organizations be allowed to subcontract with health departments?
Again, I think those are all discussions that we're having currently with a lot of those partners. So there might be an opportunity to directly contract instead of having to go through a subcontract process. But those are all discussions that we're having currently.
Okay. So the funding ends in May. So these organizations kind of need to know what the plan is.
We're having those discussions and doing that now.
These groups reportedly that are being added to the funding rolls only make up about 2% of those risks, of the risk in the state. Do you agree that that approach, given the actual data on the most at risk of transmission of HIV, are we leaving high-risk groups out in the cold with the shift in priority populations?
I don't think that's the intention. We don't want to leave any groups out in the cold, per se. As you state, I think we want to make sure that we continue to cover those populations that are currently receiving benefits from these funds. And again, it's just going to be an opportunity for us to be more efficient in how those funds get delivered. There's an opportunity for that by bringing this in underneath the state's purview. So, but no, there's no intention to leave anybody out in the cold by any means.
I understand, but with intention, that doesn't always translate into service delivery. So I'm just really concerned that this abrupt shift is maybe not based on fact and data and maybe motivated in other means.